Hello everyone and welcome to part 3 of our training session to equip you with the background knowledge you need to be able to answer interview questions. This is part 3 and the topic is adult support and protection. Okay, at the end of this training, you are expected to be able to answer questions from your interviewer when you're applying for the post of a healthcare assistant. You should be able to answer questions about adult support and protection, that is safeguarding adults. You should be able to explain your role and responsibility in relation to adult protection. You should also be able to list different types of abuse. Okay, there are different kinds of abuse. In the course of this training, we're going to be talking about different kinds of abuse: physical, emotional, and the likes. Okay, you also should be able to describe what constitutes harm, what it means for your patient to experience harm. Okay, you should also be able to explain why an individual may be vulnerable to harm or abuse. Abuse is usually from people who are close to the patient, family members, children, friends. Those are people that can usually pose abuse to the patients. All right. These are things you must know because the questions can come from your interviewer in different forms. They can give you a scenario and will be asking you what you do in that situation. Okay, so at the end of this training, you must also be able to describe what it means to understand indicators of abuse, how to notice and how to be observant when you are taking care of your patient. All right, you must also be able to talk about the nature and scope of abuse, in adults. We are going to be focusing on adults in this training session. And another topic we're focusing on children, okay? But in this case, we're talking about adults, all right? So get your pen and paper ready because we'll be talking more about adults in this training. All right. So going forward, we'll also be talking about how you can describe how your care environment can, you can make sure that as you are working in the discharge of your duties, you are doing everything you can, to not in order not to undermine the dignity and rights of the person you are taking care of. Okay, the fact that you are in a position of authority to take care of them doesn't mean you have the right to undermine their dignity and their rights. You are there to care for them and to support them. You are not supposed to order them around or make them feel any less of human. All right. Now, you're also going to be learning about how to appreciate the importance of personalized and individualized care. Okay, there's something we call person-centered care. This is a type of care given to a patient in a way that suits that particular patient, in the way they want to be taken care of. All right. You're also going to be learning about how you will apply the basic principles of helping people to keep themselves safe. Okay, there are a lot of other risk factors that you will be knowing about in the course of this training, okay, from abuse to radicalization and the likes. Okay, how you can report complaints and the procedures to take in the event of any signs of abuse. So these are things you must also know. There's something they call you have to be able to respond. Okay, you have to be able to report and record and respect. These are the important R's in this training. You must be able to report any form of abuse. You must be able to record it. You must be able to respond. You must be able to protect, people from harm and abuse. And that includes the person you are taking care of. All right. So safeguarding is a very important word in this topic. Okay, it is a term that is used to enforce measures that protect the well-being and human rights of an individual. Okay, it is most often used in relation to vulnerable adults. I mean, people who are vulnerable are people who are at the risk of being harmed or being exposed to any form of danger. It could be the neglect, it could be the risk of somebody harming them or hurting them because they are not feeling fine. They are elderly, and they depend on some other people for their help. Okay, so that is where safeguarding comes in. Okay, safeguarding is a term that is used to enforce the measures that protect the well-being and human rights of an individual, especially the vulnerable adults. Okay, so what is your role as a healthcare assistant, in safeguarding? Okay, number one, you have to develop observational skills. You have to be you have to be on the alert. You have to be very, very skilled in observation. Okay, you have to brush up your observational skills. You have to notice anything that is abnormal, anything that is different about your patient. For example, your interviewer can ask you, if you get to your patient and you discover that, oh, you can see bruises on his wrist, for example, or you notice some bruises on that wasn't there when you left him before, that is a sign that something has taken place. So you need to query it. You need to ask him further about how come that bruise is on his wrist. Okay, that is how you put your observational skills to play. Okay, and as a healthcare assistant, you must also prevent abuse, from occurring by identifying the risk. Okay, by identifying potential risk. Okay, once you see that, for example, if the brakes of your patient the brakes of your patient's wheelchair is not working or is not functioning properly, and that put them at the risk of falling. Okay, so you must raise such concern to prevent them from actually falling. You don't wait until they fall before you raise such concern. All right, so you have to treat your patients and everyone around you with dignity and respect. Okay, to remove the risk of abuse. Okay, you also have to know how to spot when an abuse has occurred or is currently occurring. Okay, when it is in progress, you have to be able to spot it as a good healthcare assistant. All right, you must also record whatever you have observed. Okay, in the course of display of your duty as a healthcare assistant, if you have observed anything, you have to record it, and you also need to know who to inform. If you notice anything, you need to inform your line manager. This is very important. Okay, this is very important. When you are discharging your duty and you notice something that is out of the ordinary, that calls for attention, you have to inform your line manager, because it is your line manager that is the next person in authority that needs to be informed whenever there is concern. Okay, whenever there is any form of concern when you are discharging your duty, you must inform your line manager. All right, so moving forward, the adult safeguarding really works in 6 key principles. Okay, basically it's about empowerment, it's about prevention, it's about proportionality, it's about protection, it's about also partnership and also accountability. Okay, when you talk about empowerment, you talk about people being supported and encouraged, so that they can make their own decision and then decide on how they want to be taken care of. Safeguarding, they own their lives. They determine how they want to be cared for. So safeguard is about empowering them so that they will decide by themselves how they want to be taken care of, and the type of care they want to be given. Okay, so prevention, another point is it's better to take action before mistreatment. So in your discharge of your duty as a healthcare assistant, it is better to take action so that you prevent the actual event that can cause harm from actually happening. Okay, proportionality is the least intrusive response necessary to the risk presented. All right, so as least as possible, no matter the risk involved, you must make sure you minimize any possible risk being done to your patient. You must make sure you protect them effectively, because they need your protection, your support, and representation is what they need the most. Okay, so you have to also work in partnership to achieve some local solutions. Okay, you have to work with your patient so that you can achieve desired result, so that taking care of them will be easy, so that your desired outcome will make them happy. Okay, that you have delivered the type of care they wanted and the type of care that they expected. Okay, because all they want is support, for them to be able to carry out their day-to-day activities that they can't do by themselves. Okay, so as a healthcare assistant, in the discharge of your duties, you must know your roles and responsibility, as part of a team. Okay, you must know how to identify safeguarding concerns and report this in accordance with local policy or process. When you get your job, you're going to be doing induction, so there's a policy that you have to follow when you notice any safeguarding concerns. Usually it's going to be your line manager, or you have to inform the person whom you have concerns, or somebody who reports a safeguarding concern to you. For example, you have to know why, and you have to record everything in detail. Even if there's a document, you have to write it down and keep that document as an evidence. You also have to understand the immediate action which must be taken if there is safeguarding issue. Okay, you also have to ensure the safety and well-being of all individuals that are involved. Okay, so in safeguarding, communication is very important. All right, an important part of delivering safe care for all adults is clear and effective communication, between yourself, between the patient and your line manager. Okay, so the line of communication is very important. All right, so that when you are discharging your duties, you need to make sure that you are communicating effectively, right from yourself to your patient and then to your manager. Communication is a joint activity. It requires effort from both the person communicating information, the person receiving the information. And when you are communicating information from your patient to your manager, you have to make sure that there is nothing missing. That is why you must record it at every point so that you don't forget, because what you don't record did not happen. All right, so very important. We need to also know how to identify types of abuse. What you don't know, how can you write it down? How can you record it? How can you communicate it to your line manager? How can you relate the concerns of your patient to your line manager if you don't understand how to detect abuse and how to identify them? So in this next heading, now we'll be talking about types of abuse and how to identify them. There's physical abuse, there's domestic abuse, sexual abuse, emotional abuse, and there's also financial abuse, discriminatory abuse, and there's also self-neglect. And all these things are things we are going to be talking about. Number one, physical abuse is when an individual, when someone's body is hurt, injured as a result of maybe physical action. Okay, maybe from assault, from hitting, from slapping, pulling their hair, or biting. Okay, this is physical. Okay, rough handling, maybe some physical punishment. Even some use of medication is physical abuse because it will come and affect your physical health. So that is also physical abuse. Okay, so how do you notice all this physical abuse? When you can see bite marks or bruises, or you see the person's hair is missing in one chunk of hair is missing from their head. That means somebody has pulled that hair off. These are things you can see with your eyes, and it's obvious that there has been a physical abuse. All right. Then domestic abuse, obviously domestic, that means it happens in the house. All right, so things that happen in the house could include maybe a threatening from their spouse, somebody threatening them, a threat from their spouse, somebody threatening them, some physical or sexual abuse, in that sense. All right, so you have to be observant, when you notice that, your patient is complaining about their money missing in their account, obviously somebody from the family or somebody close to them is tampering with their funds, you must report it immediately. Any type of abuse that is taking place within the home is called domestic abuse. Sexual abuse, like the name implies, is when you are indirectly or directly involved in sexual acts that the person has not consented to. Okay, or if the patient lacks the capacity. Some patients are having mental illness that makes them lose the mental capacity to give consent. Okay, so if somebody takes advantage of their inability to know whether this is what they want or not, somebody taking advantage of their mental situation and takes advantage of them and overpowers them, and have any form of whether direct or indirect sexual activity with them, that is sexual abuse. And when you notice such, in terms of maybe you see that there are some withdrawal from your patient, you can observe, then you talk to them further. Okay, this person is not usually withdrawn. Okay, you talk to them further, then from further investigation, you can dictate that there's been a form of sexual abuse. All right, if you notice some bruises in their thighs or genital area, or you notice a blood stain in their genital area, you discover that there's a possibility of sexual assault to have taken place. Then you investigate further. All right. So these are signs you need to look out for when you are taking care of your patient, in order to be able to take notes or immediately be aware of sexual abuse as taking place. All right. So there's also emotional abuse. Okay, when the person is beginning to withdraw, they don't want to talk. They are threatening, to cause, themselves harm. These are possible signs of physiological abuse, because somebody is depriving them, somebody is bullying them, somebody is, giving them threats that is affecting their self-esteem. This is also a form of emotional and psychological abuse. All right. So there's also financial abuse. That is when someone is exploiting them, and somebody doesn't want to give them what rightly fully belongs to them. Somebody is misusing their properties. That is financial abuse. Okay. So these are forms of abuse that you have to look out for when you are taking care of your clients. All right. So you have to have to make sure that in your discharge of duties, you make sure that you encourage your patient to keep the line of communication open, so that they will be able to talk to you. They will feel comfortable talking to you and sharing their situation with you. You must encourage them, to share their concerns. You encourage them to be as independent as possible. You encourage them to play an active part, also in decisions as regards to their health. Okay, so it's also important that as a healthcare assistant, you have to minimize every form of you have to minimize association. You don't get too involved with your clients, with your patient. Okay, you have to be professional. Okay, you have to make sure that you draw a line. You do your work as a healthcare assistant. You take care of them, but you don't get too personal with them. All right. Now, on to the next one. How do you report an abuse? And how do you respond? Okay, when you've identified that an abuse is taking place or is currently taking place. Okay, all suspicions, have to be controlled in a formal way. You have to be professional about it. When you have suspicion that an abuse is going on, you must take responsibility to respond to allegation or suspicion in line with the safeguarding policy and procedure, that of the care provider you are working with. Okay, some of those policy I'm going to mention in them is that what you do when you suspect that there is neglect or abuse taking place. You must first raise concern. All right, you have to quickly raise concern, which is very important. Raise concern with your manager that you've noticed something, and you have to document what you have noticed. Okay, you record the date and the time and the place of the incident. Once you notice it, record the date, the time, and the place of the incident. You must record exactly what the adult at risk has said. You have to use your own words. Don't formulate, don't change the words. Use your own words about how they describe the situation to you, about the abuse and how it occurred. Okay? You must also take note of the appearance and behavior of the person that is at risk. All right? How they carry themselves, their composure, their appearance, put it in your recording. All right? You have to also document a body map. You draw the particular part of their body where you notice, you observe some maybe injury. You have to put it in the part of their body, and you have to put your name, after you have written the record, that this and this is what you have noticed, and you must also put your name there. All right, there's something we call whistleblowing, so you have to escalate it and let your line manager know. You have to let your line manager know so that they can take effective procedure and escalate it so that the situation can be brought under control. Okay, because you as the healthcare assistant, you are the one taking care of the patient, and anything that concerns them, if you have not recorded it, it might be assumed that you are aware and you just ignored it. Okay, and that is not good for your job. Okay, you have to listen carefully to the concerns of your patient. You stay calm so that you can get a clear picture of what they are saying. And you don't have to give promise to them that you will keep confidentiality. Don't give promise that you have to. It's important that while you are recording and you are asking them questions, don't start promising them that, oh, whatever you tell me will stay between us. No, just let them open up as much as they want. You don't have to coerce them. You just make sure, and you don't have to pass judgment or jump to conclusion. Okay, all you need to do is to get the information from them. That is very important. All right, that is very important. You don't have to. You may have to consider asking staff members. You might ask them if they are aware of such before. You just ask your colleagues that you observe so person is having these concerns. Have they observed the same thing? Did they notice the same thing about, so that sometimes it helps with your observation. It helps you to draw a positive understanding of what the patient is talking about. All right. So it's very important that we work as a team when we are dealing with our patients. We work as a team when we are working. We make sure that everything we are getting from our patients, we don't just draw conclusion. Okay. So there are some things that can influence the people we are taking care of. Okay. Some of them, they have some history. Some of them, they have mental health issues. So some of them, they have they're isolated, they are going through depression. So you have to understand that in dealing with them, you don't make unnecessary conclusion. Document every information you have about their concerns and give it to your line manager. If, for example, during your interview, your interviewer is asking you, what will you do if you get to your patient and you discover that you notice bruises all over his wrist that was not there before? The response to such a question is that you immediately escalate the situation and let your manager know that you have safeguarding concerns about that particular patient. Okay, and then it will be investigated further by your manager. All right, thank you all for listening to this topic. It is I believe that by now you have a background knowledge on what safeguarding is, especially for adults. In the subsequent topic, I'll be talking about safeguarding in children. Okay, this sometimes you might also be asked to care for children. Okay, that's people who are below the age of 18. Okay, so there's also a way to take care of children as a healthcare assistant. But for this one, we've discussed safeguarding in adults and the possible ways of identifying and detecting when there are safeguarding concerns. Okay, so in the course of your interview, if you are asked any questions that is around safeguarding, you should be able to know that as a healthcare assistant, it is important that you recognize, and you report and you record and you show respect, whenever there is safeguarding concerns. Okay, whenever you notice issues concerning your patient that raises concern, you must be very, very alert. You must be very, very observant, so that whenever there is anything that is not normal and you've noticed it, you must raise alarm about it, so that it can be detected early and then it can be taken care of. Okay. All right. Thank you for listening to this training. You should please subscribe, because we'll be posting more videos on the training that would help you do well in your interview for the role of a healthcare assistant. Please subscribe to this YouTube channel. More videos are still coming. We're trying to cover as many topics as possible. We still have about 15 or so more to go. So if you subscribe, you'll be getting notification whenever we have a new video. Just click on the subscription button. It is free and the training is free for everyone. You can even use it in your other profession. It is not only for healthcare assistant roles. Okay, thank you for listening and God bless you.